Welcome to Healthcare Innovation Trends from the Trenches. Title of today's webinar is called Want to Capture Today's Healthcare Searcher, Go Inbound. I'm Andrea Simon. I go by Andy, and I'm president of Simon Associates Management Consultants. And thanks for joining us. We have a wonderful turnout today of people from the media, people who are involved in healthcare organizations at different levels. We have vendors, marketing agencies, and others, and we even have folks from Canada and across the country. So thanks very much for coming, and I hope we have an interesting opportunity for you to learn more about inbound marketing, the way we see it, and the way we see it happening in healthcare institutions that are our clients and in the industry as a whole. So a little bit about myself, just so you know who I am and my background. I'm a corporate anthropologist, and I specialize in working with organizations that need or want to change. And I really have developed an expertise, a change map process, and we do a tremendous amount of work with organizations that are adapting to changing times. Before I got into business, I was an executive in banking for 15 years, a professor and a visiting professor at Washington University, teaching entrepreneurship. And I set up branding and marketing for healthcare systems such as Montefiore Medical Center and St. Joseph's in New Jersey. Since we founded Simon Associates, and that's over a decade ago, our clients in the healthcare arena have included Montefiore, Atlantic Health System. We worked with Hurley Medical Center for 4 years. We've been working with St. Vincent's Medical Center for the last 3 years. We have a wide range of physician practices, specialists, multi-specialty practices, health information management companies, all sorts of companies that are in the health industry. And so it became quite clear to us that what we were seeing might be of interest to others. And we created this healthcare webinar series 2 years ago called Healthcare Innovation Trends from the Trenches. And just a moment about it, and those who have participated, who we truly appreciate, the idea of trends from the trenches came about because as an anthropologist, we spent a lot of time what we call hanging out. And it's always great fun to hang out because you see things that people don't really know that they're doing, and they tell you things that they really didn't know they were thinking. And they tell us stories that help us scope out how they are adapting to often new business conditions in the workplace, or for consumers, how they are adapting to new solutions that they have to find in order to take care of themselves. So with that as context, we began to pull together experts to help us share what they were hearing and seeing in the field. Our webinar series is available both on YouTube and SlideShare and on our website. But what was interesting was that in January, Corey Smith, who was with Healthgrades, and they have a marvelous inbound marketing platform, very different than what I'll talk about today. But he spoke about what they're seeing in terms of changing consumer buying behavior and what that was implying for how healthcare systems, particularly hospitals and health systems, were adapting. And then last month, Steve Moegling from the Franklin Group, from Franklin Street, a wonderful marketing agency specializing in healthcare advertising and marketing, spoke about the new buyer's persona and asked us all to wonder if we were ready for her. And then it seemed like a perfect follow-up to how do you do inbound marketing? Who is that consumer? Can I synthesize some of the things that Steve and Corey were talking about and provide more of a theory, method, and toolkit for you? Healthgrades is good for large hospitals and health systems, but we have lots of multi-specialty practices. What do they do? We have some smaller community hospitals. What do they do? So how do I complement what could be done by a big organization for somebody that wasn't quite so big? And yet we have large companies that we're working with as well. Just so you're clear, part of our business is healthcare and part of it is pretty agnostic, and we have companies all over US, Canada, and Mexico in a variety of different industries. A moment about HubSpot. I'd like to give them credit. I was a HubSpot user before I really knew I could be a partner. It was founded in 2006. The founder was noticing that when he put his blog up, it's a gentleman from MIT, all of a sudden people were reading it and sharing it. And he had that aha moment, which I always love working with entrepreneurs, that he began to realize that people had transformed how they live, how they work, how they shop, and they buy. But businesses weren't paying attention or if they were, it was very fragmented. And one of the themes that will come through here is how do you go from fragmentation, which we had, even as a boutique consultancy, to begin to see how to create an integrated and integrative approach that provided all the information we needed in a manageable and systematic fashion. Their vision was for the inbound experience and a platform. HubSpot doesn't do many of the things I'm talking about today. They aren't your content marketing strategist. They don't do blogs and they don't create offers, but they give you a platform on which you can do it and do it in a way that fits your business and your business needs. And so their mission we become sharers with, and how can you make the world more inbound? One business transformation at a time. Just a sidebar, partner and husband, Andrew Simon, went to their conference last September. They had expected 7,500 attendees. They had well over 10,000, and they're growing very rapidly. They're growing rapidly because we find it a simple and easy approach that's understandable. And as we bring our clients on, and I say that with all transparency, they too go, oh, wow. And so today is an oh, wow day that I want to share. So, trends from the trenches. Some of the things that we're seeing, and I pulled this out of some of the prior research and presentations, but I think it pulls it together so that you can understand the changes going on in the consumer, is only 60% of the millennials have primary care doctors. Now, what's interesting to me was yesterday I was at a business meeting with a healthcare client, and sitting around the table were 30-somethings, 40-somethings, and 50-somethings, none of whom had a primary care doctor. And I was going in for my annual physical, and we were all talking about whether they go at all, whether it has any value at all, where they go when they have a problem, like an urgent care center, where they don't want to go, which is an emergency room. But the choices that they talked about gave lots of flesh to this data. And this data comes from Klein and Partners, which has excellent research on how consumer behavior is changing. Now, the new channels that are extremely important, that urgent care center for one, but retail is taking on healthcare big way. And it's interesting because as we work with urgent care centers, their competition isn't another hospital urgent center, it's retail. And what retail has learned is that the person who comes into that mini clinic, we met the gentleman who helped set those up, they leave another $70 in that CVS when they come in. And Walgreens is now going into hospitals. They spoke at a conference we were at a year ago. And they're telling us they're helping the hospital ensure that the patient has the medications they need before they go home. Because 50% of the time they go home with a new prescription that they never fill. So it's to Walgreens' best interest to intercede at the time of discharge and make sure that patient goes home with the new blue pills and advises them on how not to keep taking the old white pills, which patients often do and often end up back in the emergency room because they're taking the wrong medications. It's common and it happened often. So with new alternatives and no PCP or fewer PCPs, what are consumers doing? And what does that mean for you? Content has become clearly king. This is Pew Research. Of the 81% of American adults who access the internet, 3/4 of those looked online for health information. That Pew Research provides a tremendous amount of ongoing insights into how consumers are changing, but they are all looking for information. I like to tell the story of a woman that we know who had knee issues, and the first surgeon she went to didn't do a good job on her knee. So she had to go back in and have some special surgery done on that knee. So what did she do? She went online. She knew what she had. She researched the condition. She went looking for a physician, a surgeon who specialized in it. Didn't do it once in a while, but did it all the time. She researched his background, his quality, his infection rates. And then she made an appointment, and he was in one of the urban hospitals. And when she went in and she had her appointment with him, he asked how she had been referred. And she said, oh, I haven't been. I researched you on the internet, and I chose you myself. She's a 45-year-old. And he said, oh, my gosh, that's happening more and more. And I guess it really matters. Well, she's not alone. And I can tell you lots of stories as we go through this of individuals who are telling you what they're doing as they're searching for the right solution and deciding that they can trust themselves maybe as much as their physician or their friends and family. They trust the information on that internet. Social media is really important, and that's the full range of it. Everything from Facebook and blogs to Instagram, Pinterest, Reddit, and other blogsters. And they use it to obtain healthcare information. Patients like me, forums to discuss things, where they discuss symptoms and care. One of my clients is an affiliate of MD Anderson. If you look at their forums, people say things like, I'm going to be going to an MD Anderson doctor. Can you tell me what it's like? And lots of other people come back and tell her what it's like. And they share their feedback about their physicians often. This is a great little chart that captures the millennials' trust in various forms of media. The product, the brand, conversations with friends and family, word of mouth still is real important. Those e-opinions, what a great word, e-opinions. The peer reviews that are online, the professional and industry reviews. Don't underestimate the power of Reddit and other blogsters and professional forums. Email, text, chat with friends and family. I've just been diagnosed. I have a rotator cuff. Can you tell me what you did when you did yours? The Facebook, Instagram, LinkedIn. LinkedIn is very powerful for some, Facebook for others, Instagram much more so than you might imagine. Then they may go on to a company website and read their blogs, their bulletin boards, and their forums. The bottom are all the old media. And so the new media has much more power in building trust than what happened before. Deloitte does a tremendous amount of research, like Pew does and PwC. This was one chart I thought captured the changes so well, and I'll talk a little bit more about the Deloitte research because I think it sheds a lot of light on power of the internet and the web for changing the way we are researching and buying things. But this was important. If you see the dark green, 26% of the millennials looked at a scorecard or report card. Not so much more than Gen X, who are also, but lots more than boomers, although there are lots of boomers who are moving in that direction, and seniors. A client of mine had a mom, and she had gone online, diagnosed herself with shingles, printed out a picture, and took it to the doctor. She was 80. So I look at this, and I know situations that are not consistent, but very, very powerful. The greed about pricing before agreeing to treatment is becoming much more powerful, particularly as people have self-insurance or they are with large deductibles. And they looked online for information about cost and prices of services. Now, from the Deloitte research, I'd like to share with you some of their insights on the segmentation. This is not just demographics. It is true that seniors and boomers are different than millennials and Gen Xers, but these are at the intersections. And within each of those, there are market segments that are worth thinking about as you're building your inbound marketing strategy and thinking about which ones might be the right ones for you and how it is applicable for you. So I'm going to talk a little bit about some of these. Others, I can refer you to the research itself, but there are some that I think are very relevant to what we're doing. The content and compliant are those folks like my in-laws who went to 6 doctors, took the medications they prescribed, even if they were counter to each other perhaps, and were very compliant. That's a declining percentage of the 4,000 adults that Deloitte interviewed. The sick and savvy has gone down as well from 21% to the 14%. The cautious and casual and cautious have grown dramatically. And I think this is coming from a variety of factors we'll talk about in a moment. The online and on board is growing as well. The shop and save is about the same percentage, and the out and about doing all sorts of different things are coming along as well. Now, the differences. What Deloitte wrote about was the emerging activists and consumers who are challenging the system. And I think this is what's real important is a perceptual change in obedience. We no longer have obedient patients, we have people. You need to think person, not patient. We were walking next to a doctor, my husband and I, not all that long ago, and he was mumbling to himself. And we said, "What's the matter?" He said, "I don't get it. I have a patient, and rather than take the lab work and the x-rays that I prescribed, he's going online and he's shopping for them. He wants to see, A, does he need them? And B, what's the best price he can get them at?" He says, "And I don't know how to diagnose and treat him unless I have that information. But he no longer trusts me to be doing what's good for him. He thinks I'm doing it what's good for me." It becomes a really interesting conversation. This motivation to activism is coming from a variety of places. Sometimes it's due to a new health circumstance. All of a sudden I've been diagnosed with high blood sugar. I'm pre-diabetic. What does that mean? Or I've been playing tennis really well and all of a sudden I have a tennis elbow. How do I handle it? Some is a loss of employer-sponsored coverage or high deductibles. Sometimes they're as high as $3,000 or $4,000. I've even heard one of $5,000. It's really not insurance unless you have a major illness. But by and large, you're now becoming a consumer, and that's often leading men to pay attention to things they didn't do before. And then there's the inability to get care they need at the price they can afford. And then it all leads to wanting to know more, and one thing leads to the next to the next. So a couple of them that I wanted to dig down just a bit deeper because I do think they are shopping and they are different in the way they are shopping. And I think they're important to pay a little bit of attention to. The first are the casual and cautious. These are the folks who have low levels of trust in doctors, health plans, websites. They lean to making treatment decisions on their own. They're working. They are not high income. 34% are uninsured and becoming the newly insured. I think the piece here is that a third of them are using online resources to look for information about health problems, treatment options, and care considerations. They are the early adapters of coming in to learn more about what it is they have to do at what price in order to get it done. They're the folks who work. Then there's the online and the onboarding. These are folks who use online tools and mobile applications, and they're assessing the provider. They're comparing treatment options, and they're looking at the provider competence. Now, the first group, I said were working folks, some insured, some who have lowest incomes. Here's the highest incomes, with 25% of these over $100,000 in income. This is the heaviest user. 63% of them are the heaviest users of online health resources, looking for that information and evaluating their treatment options. They're interested in using price and quality to compare plans, providers, and treatments. Now, I was doing a workshop in Dallas this week, and one of the gentlemen has a medical device company, and all he could talk about was that the future is going to be in that iPad, that iPhone, and everything that you need is going to be controlled remotely, and that it's coming and it's coming fast, and telemedicine is going to add tremendous opportunities with it. He may be a little ahead of the curve, but he's developing innovative solutions to add value in tremendously new ways, and it's making it happen. Then there's the shop and save value purchasers. That was a gentleman who was talking to the doctor we were walking next to. They're value purchasers who are not content with paying more under any non-emergency scenario. That's 24% have over $100,000. This sort of is interesting. That's why I said it's not demographics. It's a lot of this differential psychographics. 52% looked online for information to compare health plans, providers, and treatments, and they are looking to make treatment decisions for themselves. So we see empowerment. We see a wide range on the income scale. What we don't see are people who have been raised to be obedient. What the doctor tells me I do, I stay compliant on my meds. What the doctor gave me as a prescription when I was discharged, I go fill and take. That's not these. How many of them? Corey Smith mentioned in his Healthgrades presentation, there's 1 million people a day searching for a doctor every day. In one client region, we had a county in the Northeast. There were 750,000 plus or minus people last year who looked for a doctor. 34% who found them made an appointment that day. 70% were commercially insured. These are the folks who we just spoke about, who have choice and aren't willing to go into the old funnel to find the old solutions. Well, what does that mean for us? What are we going to do about this? We can't push information out, advertise to them, hope they find us. They're using the web as an effective method for finding, research, and selecting. They're empowered. They understand how to evaluate, and they're becoming really good consumers. So, as I said today, let's go inbound. What is it? How do we think about it? What's a philosophy around it? Why it works? What's the methodology? How does it work? And the tools and the playbook that works. Now, I'm a 3-person. I like to tell you things, tell you again, and tell you again. I try not to do that too much today, but it helps as you begin to understand it. So first, what is it? The consumer is shopping. What does that mean for the business, healthcare and otherwise, to capture the one who's shopping? I can't simply say, come, we're the best. Instead, I have to begin to engage them differently. Inbound marketing is about creating educational, informational content that is put out in such a way that it pulls people towards your website where they can learn more about what you sell on their own before they're even ready to buy something. Inbound is an approach to marketing that reaches today's consumer with website pages, blog articles, social messaging optimized for search and social media. I cannot tell you how many clients are coming to us. Their old brochures are flat, unengaging, and uninteresting, not useful. Their directories, we're redoing one entire one. It was nothing more than a telephone directory. And putting on content that can pull your buyer through the sales funnel and use it to personalize your marketing message at a big scale. So this is marketing with a magnet, we say, not a sledgehammer. The philosophy. It's a philosophy based on the truth that consumers buy differently today than they did 10 years ago or even 5 years ago. It's along the life cycle. They go through different stages that interact with you and your company, and each requires different marketing actions. It's really not one size fits anyone anymore. It's very, very much about where are they, what do they need, and how do we accommodate it. It's a personalization of context. This is very much personal because they're going to find what they want somewhere. And if it's not you, then it's someone else. And the competitive set has changed. So as you learn more about your leads over time, you're going to personalize your messages. Many channels. They are looking at it everywhere. There was some great stuff in last month's presentation that Steve Moegling did about people look at their iPhone in the morning, their desktop or laptop during the day, and their iPad in the evening. That may be what you do as well. But I also know stories about people who do everything on that iPhone, the iPad becoming less important, and then they have their desktop. But there are multiple channels. I know what they're not using is an 800 number. So this is real important. So it's a multi-channel. It approaches people where they are, and it's one where they want to interact with you. It's very integrative and integrated. Your publishing and analytics tools all work together like a well-oiled machine. So you can focus on publishing the right content in the right place at the right time. Now, I'm working with a client now, and they really love to get right to the end and the sale. And I'm trying to help them realize that the buying process doesn't stop at the end. It starts at the beginning when I have a problem I'm trying to find a solution to. So this is not inconsequential. So inbound marketing is about building trust. So when they find you, they begin to believe you are their solution. By being loved, I go there all the time. They know what I need. I know how to find it. It's not ignored by your customers. And it's a lot about delighting them after they become your customers to keep them engaged. And it's outsmarting, not outspending your competitors. Let me tell you, there's a huge content marketing war that's emerging, and everybody's trying to get on that first and second page of Google. So how does it work? The method is a system that helps brands attract, convert, close, and delight visitors. How it moves you through the buying process is real important, using a variety of tools. It's built around your consumer who's on a journey. They're on a journey from being a stranger to a user to a promoter. Now, I remember in Marketing 101, way back when, we talked about it. But the nature of the beast has changed as people become much more empowered and much less trusting. I'm going to go through this. I leave this up here because I remember the old sales funnel looked similar, sort of. But now it's changing the nature of the push to pull them down to become wonderful promoters. So let me take you through it this way. And then I'll come back and I'll go through a little more detail. First is the buyer. They start out as strangers. They're not quite sure what, in fact, their problem might be. They're pre-diabetic. How do I write that? What am I putting in when I Google? And you'll find as you become more attuned to keywords, they can put in pre-diabetic, or they can put in best treatment for pre-diabetic, or best treatment for pre-diabetic in Manhattan, and they can begin to see all sorts of different things emerge based on what they put in there. Your job is to begin to capture them as strangers and get them to visit you, and turn that you visiting person into a lead, and then into a customer, and then into a promoter. So they're going through the funnel. Our job is now to attract them, to convert them as they consider whether we're the right solution, to close them, and then delight them. And what we use are all of these tools on the bottom. Now, I love the chart because it takes the buyer through their process, the tools we have to use, the methodology we have to use to take them there, and then the tools we have to do it with. And sometimes we use them in different places. A blog can be used to convert and to close and to delight. But we put it like this so you can begin to think about them as the methodology as we move a buyer through their journey and the tools that we have. So quickly, if I'm going to attract strangers and turn them into website visitors, I better have some great stuff on that website. Now think of that website no longer as a brochure, but as an active communication device with good blogs and media, lots of social media, keywords so that your pages aren't filled with 20 keywords. Google doesn't like that anymore, but the major ones. And make sure you're writing with those in mind, but not with too much so that you don't have too much density. And your pages provide valuable material. I can't tell you how many websites we work on with healthcare providers that they provide no material. They're there, but they provide as little as they thought necessary. And quite frankly, you should be putting 800 to 1,000 words on a page because Google wants you to be the authority on this. And they're looking for good content. So it's no short, it's now long, but good content with good visuals and good YouTube videos if you can add them. Now, once you've got that, you want to attract them who will become leads. And that buyer is creating content that's valuable and easy for them to find so that your website and all of what you post there is written for both the searcher and the search engine. I want to emphasize that. I'm working with a client now, and this is common in hospital websites, and they're writing at a college-educated level, a 10th grade or above. Google reads 5th grade level. Your searcher may find the 10th grade or college stuff good, but by and large, you got to find something between the searcher and the search engine so that you're serving both. Now, once you've got them inside and they're beginning to wander your website, you want to convert them. How do I make that visitor turn into a lead? Should be going through your head now. And what do I do in terms of that blog that I wrote to convert them into something that will help me understand who they are so I can actually do something? So I got visitors to my site. I have to convert them into leads. Now I have to get some valuable information to offer them in return for their information. Now, one of the questions that came through, I had sent out a request for questions. One came through. First, I sort of discounted, and then I thought about it. I said, that's a good question. Why would I give you my email information, much less my name, my address, even my phone number? Well, from the perspective of the consumer, there's something on this that I could really use. A video I want to watch, a webinar that could be of interest, a white paper that's well done. I trust them to give me stuff to help me in my decision process, and I'm willing to give them some information. On the other hand, from the perspective of the institution or the organization or the company, if I can't find out who it is, I can't help them through their decision process. And so there's lots of interesting questions that go on here, particularly about how sales ties in with the marketing and the lead generation that often we have to work on. Okay, so they gave you their information. There's something that you gave them that were the 5 reasons why your company can solve their needs the best. Or read this white paper on why a pre-diabetic should get care in the following way and why exercise could really help when you have early heart condition. Now, I want to convert you into my patient where I'm giving you care. And I want you to think of me and my institution as the right solution. And so now I have to begin to cultivate you as I turn a lead into a customer or a patient, a consumer that turns into someone who's using you. And this is where follow-up emails. There was a blog today posted, I think on HubSpot, in fact, about how Facebook and Twitter and Pinterest are hard to get ROIs on, but emails work. So don't underestimate emails, particularly those that you're not buying, but the ones that people have given you. In fact, most of you have attended today either all or some of our webinars because of the email that somewhere along the line you were kind enough to share with us. Now, you've got them. Now what? You need to transform them into customers with targeted automated email nurturing. And the nurturing phase shouldn't be underestimated. The conversation has now gone from impersonal to very, thanks for downloading our white paper on it. Could I help you? Is there more information you'd like to have? Would you like to come to an open house? Would you like to meet with one of our consultants? How about a liaison who is a great nourisher between you, a navigator between you and the care that you're searching for? How can we get them to begin to think that we're not here to sell, but to provide a solution? And then, man, I never see this happening. It's exactly the right place to go. You finally brought that new mom in with her baby, and she's your pediatric patient. Fantastic. How do you delight them? How do you add new things, even silly things like recipes, so you can have a healthy child? And the recipes sell really well, as my client is learning. So this becomes an interesting way of delighting customers into promoters of your brand. An oncology program we're working with is bringing in MD Anderson specialists. How do we get others to come here? How do we engage the survivors of their program to come and learn more? What about seminars that we're throwing that others should bring their friends and family to? Men's health. We do a lot of work in men's health. How do we get men to realize that 60% of them don't have doctors and most of them don't stay compliant and they're real stoics? How can we bring them in and have them see how we could help them better? You don't stop when you have that customer or even a patient. Don't wait for them to get sick again. You keep engaging with them, and the methodology is both easy to understand and extremely affordable to implement. So now that I've given you the philosophy and the method, how about some tools? I'll be simple here because I want to give you two illustrative case studies that I brought in, and not because they're ours, but because the results are so good that they are very compelling. So the first step is, how do we attract them and turn them in? Blogs. So let me tell you more about blogging. Blogging is extremely important. It's the most effective ways to attract potential customers to your site. Blogging works. 55% more website visitors, 97 more inbound links, 434,000 more index pages. Pam Angst is a social media expert in New Jersey, and she has a great video on YouTube. She tells a story about a gentleman who had done nothing, and he starts to blog, and he puts a blog up every day. And for 3 months, nothing happens. And in 3.5 months, leads start soaring. Google likes to know he's an authority in the field, and all of his blogs turned him into that authority in the field that he was promoting himself in. And all of a sudden, it went from 2 millionth to second page, first page. And all of this because he started telling good stories that were meaningful information through the blog mechanism. This is a survey of 2,300. Those who blog had an average monthly lead growth of 160%. Versus 60% with no blogs. Multiple times a day. People yesterday said to me, how often shall I blog? Once a week. That's not bad. Multiple times a day, that's hard to do. Daily is really perfect. 2 to 3 times a week works fine. Try not to do it monthly, because it really is a very powerful method for getting what you would like to happen, which is people find you. Now, it's not the only tool. So don't think I blog and that's it. Somehow you've got to share it. The methodology that I like is immediately when you blog, you post on Facebook, on Twitter, on LinkedIn. You can now send it out as an email. You can do lots of things with it. Think of it as, if it's worth sharing, who do I share it with and how do I do that? Keywords. This is a HubSpot chart. We use it constantly. You can download it, create an Excel spreadsheet out of it, sort in a variety of ways, build your campaign. It's Google Plus better. You can get your search stuff off Google. We've done that with many clients, but this one is really cool because you see what your demand is, what your competition is, where you rank, and how you're increasing it. And then you can see what pages are helping you do that. It gets you really down to the granular. At the same time, it helps you identify, what do I want people to come to me for, and what keywords are they using to get there. If you keep your website fresh with easy to deploy site pages, that's fabulous. So I love the words here that I like to tell people. It's a beacon of helpful, fresh, optimized pages appealing to my buyers. And I don't have to do IT at all. And my IT folks get irritated, but quite frankly, I can add landing pages, new pages to the website with ease. Now, once I got them coming, I convert them into visitors with calls to action offers. And that question about, will I give you my stuff? That offer better be good. And a call to action is that button or link that encourages you to take action and download a white paper, attend a webinar. And if I don't have it, they're not enticing enough, you won't generate the leads. Now, this is all about how you help them find solutions and they help you help them. So it's not one way or another. It's very much engaging. Sales. I make the point here, sales and marketing often work at odds. I had one client and the leads were coming in and the sales were going elsewhere, doing cold calls in the old way. This is about integrating the tool and having a common, aligned approach. And it doesn't matter whether it's a college we're working with or an event marketing company. Everybody has to see this as a common process that's well integrated with common goals. And we use forms, different forms. And the question about, will I give you my email? What will I give you for? And what is it worth to me? Now, all of it should be in one place. This CRM, actually, I saw my trend when HubSpot approached us about joining them. I was fascinated. They had everything I had ever done on their HubSpot website, stuff I had downloaded, webinars I had watched, videos I had engaged, things I had shared. Really little, wonderful, and interesting. Now, then we turn them into customers using email and CRM integration. And if they click on my call to action and we fill out the form, I'm not ready to be a customer. What do? Well, I ask them and I focus on relevant content until they are ready, which helps me in integrating all of this with my CRM. And I can see everything they've done. I can begin to see how they are by persona developing. Once they become happy with me, we got to keep them staying happy. Why not think of a patient as a future prospect? Think of a patient as the most valuable thing you have, a customer who's going to come back often. And that doesn't matter whether they visited your primary care, your specialist, your urgent care, your x-ray center, or your ER. Think about this much more broadly as how can I keep them thinking of me as the solution? So it all comes together. We attract and get them. They're going through the process of becoming, I'm searching for something because I hurt my tennis and my elbow is killing me. Or I fell and my hand and my wrist is broken. What shall I do? Or carpal tunnel and I've been working hard and I can't seem to get rid of the pain. Or I have a real nerve that's bothering my hand. How about I get them to become a lead through calls to action, landing pages with forms that serve a real function for them and us? Think of it as a well-tied together relationship that's developing. And when they become my customers, I keep working them through the process. So often I go through this very simply. Who do we want? Let's create a persona for them and let's create a story. So for one of my clients, we have Betty and Jennifer and Dawn and Tom. And they each have personalities and different needs. And that's how we begin to think about the keywords they're using and writing blogs that are relevant for them, that will add value for them, with landing pages and offers. And there's lots of ways to know how to design the best ones. I will tell you that images are great. People buy pictures and they buy from people. Videos are useful. Webinars are cool. And then we engage them. And it doesn't quite matter their age spectrum. Think of it as people who need to know more, like that wonderful mother of that client of mine who had shingles. She needed to know more. And how did we do it? So a couple of healthcare related case studies. And I chose these. I'd rather not share my clients, and they're really on the early stage. These have been using HubSpot and the process for a while. And the data is very compelling, and it provided us with case studies that really reflected the wide audience that had signed up for today. Tufts is a health plan Medicare preferred provider. Has been committed to providing the high standard of health care for every member they represent. By and large, it's an older adult. Their marketing team knew they had to generate leads to increase their enrollment. And they realized that it was no longer enough to say the older adult doesn't use the internet, because in fact, they were using it and they were very savvy, and they needed to drive more traffic to their website. But like so many places, their website had evolved in fragments. There was a doctor search tool. There was an online enrollment. There was a drug coverage information. Things were externally hosted. The website was more of a directory, a brochure than an active and involved entity. Now, the older adults they knew were driving online traffic. And when they put on the HubSpot end-to-end enterprise software, they began to see things change. They provided tools they needed to track visitors. They wanted to learn more about their online visitors through all of the data that was available. Now, was there a way to connect the dots? And that usually is a question my clients come up with. We're working with a multi-specialty group. How do you connect it all? Google Analytics gives us stuff, but how do we know that turned into a person who came to a seminar and became a patient? And how do we do that with orthopedics? So how do visitors use a website and enable them to provide the best experience? So landing pages became a way of capturing the lead information. And by 2012, they had increased their leads by 69%. The dashboard that's available provided a unique insight into shopper behavior that they didn't have. And the first thing my clients do is go to the dashboard. And some of it is easy to understand, and some of it is a little, how did that happen, and where did it come from? But you can see the emails that were sent out turned to people who clicked them open and who then downloaded the offer and gave you more information. So it becomes a really interesting, good process that the dashboard enables. Today, they can connect the dots and track users directly to see what online passed. Now, one of the things that we learn is what works and what doesn't. And so as I watched their organic traffic increase 47%, it became really clear that something they were doing and some of the things they were doing were working well, and some things weren't working at all. And you can begin to shift your focus to those that work well. 7% increased organic traffic year over year. So people were organically coming to them. 69% increase in leads and a 181% increase in leads in 2013. There's something really powerful in those numbers, and I share them with you. This was the second case, and I like it a lot because I have a friend whose husband is a dentist, and I sent this along, and I said, it might be worthwhile to think about this. This is Legacy Dental, focused on outbound. They're in Salt Lake. They focused on outbound tactics like print and pay-per-click advertising. They couldn't manage or edit their site. They had no SEO plan. And I know website designers don't become HubSpot, but they should. But they need to gain independence and develop a strategy. Who are they? They're dentists, and dental professions help patients achieve high levels of dental health in their lives. They offer comprehensive family care, cosmetic dentistry, sedation. They provide emergency care. They relied mostly on print advertising and pay-per-click, as I mentioned. Then they began to optimize their website. And their website changed from a brochure to something that was designed to help you really find the dentist that you needed, so you could schedule a dental appointment today. If you were interested in cosmetic dentistry, you could download your free report. And guess what happens when you're downloading your free report? You're going to tell me a little bit about you so I can follow up. With simple tools, they can find and track their best keywords. They track inbound links, optimize each individual web page. You know a lot about what's working and what's not. And a content marketing strategy. It's all about the content, remember? Visits to their website due to organic search increased by 169%. That's just a lovely client that just, makes everybody really happy. Because in part, you're doing things and you see results, and the results turn into patients that matter. Now, they became active bloggers. And their blogs help new patients come to their website, keep their patients informed. Do you need to take antibiotics before your dentist appointment? Often they come from questions that patients have asked and that want to know something. The best way to think of your blog is 5 things that my patient asked me yesterday, or the 6 things that I've heard in the last 3 weeks from people who are interested in, or how to best, evaluate this as an option. People are looking for answers to questions, and it's real important to know whether or not this is the right solution for you. Now, in the past 9 months, their leads have increased by 300%. Not bad for a dentist, which is why I thought maybe my friend's husband might use it as well. The proof and the result, their quote, "Our website is now generating 50% of our new patients, up from 10% before starting. With HubSpot, I save money because I don't need to focus on print advertising. And quite frankly, it's extremely, really efficient." So now I've done as much as I thought was appropriate for today. And I see we have some questions that have come in, and we had some questions from before. So I thought I might begin to share them with you. And we're always welcome to share more questions and answers afterwards. So let me go to the question that came through that I touched on a little bit. How do you tie sales and marketing together so that the two work in sync? Now, not knowing whether or not you're a plastic surgeon, for example, plastic surgeon is a great medical or healthcare area because so much of it is simply elective. The question is, how do you get your office manager to take a good look at the leads coming through for people who want to know more about Botox or liposuction or breast implants or tummy tucks? And I share that because we work with plastic surgeons and we find it interesting. It's such a perfect illustration of how to get alignment. So now the leads come in, and the person who's going to convert that can't be the doctor because he's busy making business. So how does he get his sales team to begin to appropriately respond to those leads in a timely way, not too fast, but fast enough so that they get an email back? A question, can I set up a time for you to meet with the doctor? Perhaps a seminar that we're holding on Botox, or a Botox party day where you can come in and we set you up every hour for your Botox. All sorts of things that can be done. But if the sales isn't tied in with the lead, we got a lot of stuff that happens that doesn't turn into business, and there's no ROI on that at all. In a whole different area, how about pediatrics? Patients are going to want to know more about their child and obesity, a big area of concern. So they Google, and they come upon a doctor who's really specializing in caring for children with obesity, early obesity, and you really want to get on top of it. What's the white paper? What's the webinar? Perhaps there's a video, or perhaps there's an upcoming open seminar. Or how do we then email back and say, Dr. Simon would be delighted to meet with you and your son or daughter and discuss how we might be of help? What do we do to align them so it works well? Or a hospital case study. They're having people take cardiology surveys to assess their risk assessment. What happens? How do we then convert them to interesting, important prospective patients? How do we introduce them to a cardiologist who might be able to evaluate their results in a fashion that works well together? And in other industries where we work with them, we have to make sure that there's an alliance between the sales and the marketing so that it all works in concert. Now, the delight, I had a question. What do you mean by delight? A patient has come in and has worked with you. A person has come in and is working and buying your services. What would they like beyond that? Have we thought about it? How can we add value without selling something? And how could we make them more knowledgeable about why we're the right solution for them, their friends, and family? Because we're here for them. So, a common thing is baseball season. A lot of kids who have pitching shoulders, or soccer season, a lot of kids with concussions. So maybe it's concussion prevention. And maybe it's how to keep your son from pitching too many of those softballs or baseballs so they don't end up with an arm that won't work at all. So it becomes real important. And my last one is about seniors. So much of our healthcare is designed around older adults and all those boomers who are moving in. And I can only tell you the boomers are hot on this. Don't underestimate them. If anything, over-care for them, and they'll think you're the best thing that's coming. Now, we're just about out of time. I want to thank you for joining us. It's been a pleasure. I will tell you that our next webinar It's on robotics, machine intelligence, and the new healthcare. Remember, I said first person down in Dallas was talking to us about robotics and medical stuff that's becoming all automated in the Internet of Things. This webinar will explore an aspect of that change, the advancing field of robotics and machine intelligence, how it's particularly impacting hospitals. And Donald Bellefeuille is going to be a marvelous speaker. I've met with him several times, and his work is just wonderful. I hope you can join us. If you would like some of our prior webinars, they're all available, both on our website. You can always email me. What we'll be doing is taking this recording, connecting it to the PowerPoint slides, and sending it back out to you. Share it. Any questions, please feel free to let us know. Any thoughts you have on upcoming webinars for next year, I'd be delighted. We're already booking into September and October, and we look forward to sharing our insights with you as often as you'd like to come. So thanks again. I'm going to say goodbye and sign off for today. Have a great weekend. Bye-bye now.